Hi, hello, hello. Welcome, welcome, welcome. Welcome to Q&A with Dr. Mercy. I'm Dr. Mercy. Come on in. Happy Friday, happy Friday. Welcome. Now, if you can see me, just let me know in the chat section. Just say, hey, and also let me know where you are viewing this from, what location. Again, happy Friday. Just waiting to see some comments. Can you see me? Hi, welcome. Okay. So let's see. Are we seeing? Let me see if I see some comments here. Huh. Hello, welcome. Let me go to the comment section. For some reason, I'm not seeing any comments. All right. Well, I'm going to continue on. I do not see some comments, which that's not really typical, but that's okay. I am going to go ahead and continue on. Hi, welcome to Q&A with Dr. Mercy. I am Dr. Mercy, and thank you for joining me. Usually I see comments, but it seems like today I'm not able to see any comments, but that is okay. We can just go ahead and continue. So if you're writing any comments and I can't see it, I'm so sorry, but hopefully I can see it after the broadcast. So welcome to Q&A with Dr. Mercy. This is a live that we discuss all things health. And I decided recently that I want to kind of pivot. Normally, we talk about one condition and we go in depth into it as far as, how it started, what are some of the risk factors, and what are some of the treatment options. But I'm thinking this time around that I would like, okay, okay, I'm sorry. It seems like I was, for a while there, I was just, it seemed like it was stuck. But let me go ahead and continue. So it seemed for a while now, I want to actually go more in depth when it comes to uh, lifestyle and how lifestyle can play a part in your preventing or treatment of diseases. And so, being a lifestyle medicine trained physician, that is the angle I'm going to be talking about moving forward for a considerable amount of our sessions until I decide that I want to take it to another direction. So, today we're going to talk about a topic that we've talked about many times here, and it is a very important topic. It is the topic of dementia and your lifestyle. Now, like I said, we've talked about this dementia topic many times. Talked about it by when I was discussing it by myself, as well as with a colleague, Dr. David Ajibadi. But I decided that this time around, I wanted to kind of give an angle of dementia from the standpoint of your lifestyle, because it is very important how your lifestyle plays into getting dementia in the first place. And the reason why I wanted to go back to dementia is you'll find out later in this presentation. So let me go ahead and begin. Again, if you're joining in, I cannot see the comment section. Normally I usually do. So if you're writing any comments, questions, just continue to do so. I'll probably will address them after the live, because for some reason we are having technical difficulties with that, with the comment section currently. So if we go to the next slide, the reason why I decided to talk about dementia and go back to it is because of the recent news of certain celebrities that have dementia. The one in particular that kind of made me do this topic today was Wendy Williams. Now, if those of you who don't know Wendy Williams, she is a media personality. She had a show called The Wendy Williams Show, and she, in 2023, was diagnosed with dementia. In particular, it was frontotemporal dementia. And also, she was found to be aphasic. And what does aphasic mean? Well, aphasia pretty much means having difficulty with speaking, um, various difficulties, or not being able to speak at all. And so, this frontotemporal dementia is a type of dementia. There's many different types of dementia. The one that's commonly heard about is Alzheimer's dementia, uh, followed by, Parkinson's can sometimes have dementia, followed by Lewy body dementia. This is a frontotemporal dementia is a dementia that is, just like the name applies, it affects your front portions of your brain, as well as the side portions of your brain. Frontal temporal. Frontal means front, temporal means the side. So it's when you have damage to those areas of your brain, causing you to now have symptoms of dementia. And those who have frontal temporal dementia, this particular disorder, they tend to have trouble with thinking, but some may still have intact memory. They just may have some trouble with thinking. They tend to have trouble with planning things and thinking through things. They definitely have this tendency to repeat activities over and over again. They have trouble prioritizing things. So if something's due tomorrow, they may not, and there's other things that are due after that, they may not be able to prioritize how they should do certain activities. Okay, now I am seeing a live. Thank you, Karen Juliet. I am now seeing it here. You say that you work in a memory care. So you know that all about this. Thank you so much, Karen. I needed that because I couldn't see the lives for a while there. Good evening, Karen, to you too. So language and movement can, and I'm sorry, I put that can was spelled wrongly, can be affected. So in Wendy Williams' case, it is affected. Share of speech is affected. And over time, you would need supervision and care. Just like Karen Juliet said, you would need, there's memory care facilities for patients with dementia. And over time, they become dependent, needing either assistance from their family members or assistance from a nursing home or a memory care center, as Karen Juliet works at. So I also put another celebrity in the slide. His name is Bruce Willis. A lot of you guys may know him. He was a really famous actor, particularly in the 80s and 90s. And he also has frontotemporal dementia, very similar. And also, I think he's also aphasic, but don't quote me on that. That's alleged. So this is a very much important disease. And just to kind of go and rehash what we've talked about in the past, dementia is a significant global problem. It is actually getting higher in incidence, meaning that a lot of people are becoming diagnosed with this. And it affects African Americans and Hispanics a lot higher than Caucasians. So this is a slide that shows, this is from the actual Alzheimer's Association. And remember, Alzheimer's is a type of dementia. And this slide just really much shows a graph that shows the differences of how many people have dementia across the ethnic groups. If you see in this graph that's on the right-hand side, the orange is shown how many incidences or groups of people who have dementia and are Caucasian, while the green shows how many African Americans have dementia, or the incidences of African Americans having dementia, and then the gray shows how many Hispanics. So if you can see, compared to the Caucasian, both the Hispanics and the African Americans have almost a doubling rate of incidence of dementia. So it is getting higher and higher. Okay. And so, like I said earlier, Alzheimer's is usually the most common one that everyone have heard of. And, but there are others, just like we've discussed. And age, genetics, even your heart health, and definitely lifestyle choices contributes to whether or not you can have dementia. So hear me clearly. You can have the gene for dementia, but something like having a good lifestyle choices can prevent you from having dementia. And other factors can prevent you. So the goal of this presentation is to let you know, okay, so how can I maybe reduce my risk even if I do have a risk of dementia? And how you would know that you probably have a high risk compared to the general population is if you notice that, maybe your auntie or your mom or your dad or even your sister has dementia. If they have dementia, there's a high chance that you have dementia. If your grandparents had dementia, high chance that you have dementia. You will have dementia. So how do we reduce our risk? Well, first of all, what risk factors increases your chances of having dementia? Just like with any lifestyle, if you have a decreased movement in your daily activities, meaning if you're always sitting in the couch, you're not moving around, you're just kind of in one place, that is considered a sedentary lifestyle. If you have a sedentary lifestyle and you're not that active, that increases your chances of dementia. A poor diet increases your chances of dementia. So if you are just, McDonald's all the time, sorry, McDonald's, but, it's not an entirely nutritious meal. If you're always eating out, heavy foods with high glucose, high fat, those fried foods all the time, you're increasing your chance of dementia. Chronic stress can increase your chance of dementia. Not getting enough sleep can increase your chances of dementia. And then even isolating yourself can, you're not having a group of community, you're always by yourself. That can increase your chance of dementia. Smoking and excessive alcohol consumption can increase your chances of dementia. So in the case of, some of the celebrities, particularly the one that, like for example, Wendy Williams, allegedly she had excessive alcohol consumptions throughout her years, not knowing much about her smoking history. So that didn't help her when it comes to her risk of dementia. So how does lifestyle then play a role then? Well, lifestyle plays a role because you can counteract, like I said, you can counteract all the chances of you getting dementia by just having an optimal lifestyle. So regular exercise. And when we say regular exercise, all we mean is moderately paced exercise, moderately strength exercise, only about minimally 150 minutes per week. So what is 150 minutes? If you divide that by 3, that is about 150, okay, about 50 minutes, 3 times a week of moderately intense exercise. And I'm about to show you what that means. Having a healthy nutrition. So example, the Mediterranean diet. For some of you, or for all of you who may know the Mediterranean diet, it's really consisted of more plant-based diet. So it's more fruits and vegetables, sparingly meats, and definitely sparingly fattening foods, sparingly processed foods. So it's heavily on fruits and vegetables. Mental stimulation. So keeping your mental mind active, and that is through different activities, whether it's games like playing chess or, just if you're in a very mentally stimulated job that requires you to problem solve, or just, being active, talking to people, having some sort of mental stimulation, reading books. That's another example of mental stimulation. That has shown, research has shown that that's helped decrease your risk of dementia. Stress management, like we said in the previous slide, if chronic stress can increase your chances of dementia, obviously, if you're able to reduce your stress, that will help you as well. And so, examples of reducing your stress is meditation, is one. You know, doing things like yoga is another. Walking outside and just experiencing nature is another. Uh, getting help with a psychologist, another example. Hi, Verna, how are you? So these are just the ways that your these are just the ways that you can change your lifestyle to help you reduce your risk of dementia. Quality sleep, the average adult should be sleeping anywhere from 7 to 8 hours a night. Are we doing that? Previous lives, we've talked about the benefits of sleep. And when we say quality sleep, you may be in the bed 7 to 8 hours, but are you actually sleeping? There's some people who have sleep disorders like obstructive sleep apnea, where they're snoring a lot, and then in between the snoring, they have a pause of breath, and then they have to breathe deep again, and then they go back into this snoring pattern. Well, is that quality sleep? No, it isn't. And so they wake up after their 7 to 8 hours still feeling drowsy, still feeling like they want to sleep. They have daytime sleepiness. So in order to treat that, you have to get a sleep study. So are we getting quality of sleep? Are we maybe 30 minutes to an hour before we go to sleep? Are we turning off all social media, all electronics? Are we preparing ourselves, having a good sleep hygiene? And we talked about this in one of our lives, what a good sleep hygiene constitutes. Are we doing that so we can get good quality sleep? And lastly, social engagement. We just said this, not being isolated. It's not just the Facebooks, it's not just the Instagrams, but are we actually out and about? Are we talking to loved ones? Are we talking to friends? Are we going to groups? And we talked about this, I think, when we discussed depression, getting involved in different groups, whether it's in church, whether it's things like meetups, those sort of things. They can actually play a role in reducing your risk of dementia, even with those who have underlying genetics for that. No problem, Katrina. Thank you so much. So, getting to what the moderately paced, yeah. So, what is a moderately intense exercise? These are exercises that you can do when it's called moderately intense exercise. The definition of exercise are examples like this: walking 2 miles in 30 minutes, biking 5 miles in 30 minutes, swimming laps for 20 minutes, running 1.5 miles in 15 minutes, doing water aerobics for 30 minutes, playing volleyball for 45 minutes, and playing basketball for 20 minutes. These are moderately intense exercises. So if you do 150 of the minutes per week of these moderately intense exercises, then it should help you as far as your health in general. So, did you know that drugs can be linked to dementia? Yes, you hear me, drugs. And there's some of these drugs are drugs that are commonly used, and they're even over the counter. Now, with everything, I always like to say moderation is key. Even water, if you drink too much water, can affect you. So just because you see this drug on this list does not mean that, oh my goodness, I can't take this drug ever again. No, what it means is you should be very mindful not to overdo your use of the drug. Use it sparingly. Don't use it so consistently to the point where now it's adding to your risk of dementia. So examples of these drugs that are linked to dementia are, for example, Benadryl. Did you know Benadryl, Advil, Tylenol PM, Advil PM, anything that contains the active ingredients used for Benadryl, definitely, which is the diphenhydramine, definitely, or long-term use can cause or increase risk of dementia. Some of the allergy medications, such as Chlorotab or Lurochlora, chlorocidin, HBP, long-term use, meaning consistent, can cause it. Some antidepressants can cause this too, as you see listed here. Irritable bowel medications, there's some over here that can cause it. Even those that are overactive bladder medications, as you see listed here, can cause it as well. And lastly, protein pump inhibitors, which are the anti-acid medications, like the Prilosec, like the Nexiums, like the Protonics. Over a long period of chronic use of that can cause your increased risk of dementia. And protein pump inhibitors, the goal of that is to use it as a treatment for a limited amount of time, just enough for it to reduce the amount of acid in your stomach, and then you slowly wean off, because they can not only cause your increased risk for dementia, but other effects as well. So just working with your doctor on that is good for you. But the whole purpose of this slide is to say, too much of everything is bad. Water can be bad in high doses, and certain drugs can be bad if you continuously use them on a long, frequent basis. Hello, William. How are you? So, not in conclusion, but midway, changing your lifestyle offers promising avenues for prevention of dementia and treatment. So now I'm going to give you the last few slides are just illustrations from an article that was written from the key experts in dementia. It was in the Lancet magazine, if you will, article magazine, which is one of the popular medical article magazines that we as doctors look to when we are studying more about the up-to-date treatments of different diseases. So pretty much they reviewed all the studies that have been in dementia, and they came up with a conclusion of what things can be done to help prevent your risk of dementia. So I wanted to just go over some of their illustrations just to give you an idea of what the experts also come up with different things people can do to decrease their risk of dementia. So if you look at the first row here, these first boxes here, they're saying that if you are able to treat certain chronic diseases, such as diabetes or high blood pressure, and you're able to control it, that minimizes your risk of getting dementia. Studies have shown that those who have uncontrolled diabetes, and definitely those who have uncontrolled high blood pressure, they have an increased risk. When they compared those with uncontrolled high blood pressure to those who have ideal blood pressure within the same age, and then they followed them up to see, how they're doing over time, those whose high blood pressure were not treated ended up having a high risk of dementia, and some of the people in that group actually developed dementia, to the point where in some studies they've actually had to stop the study because the differences were just so apparent. Also, head injuries can cause dementia, as as we have heard, in the football world or even in the boxing world. People have had this traumatic injury as a result of multiple head injuries, or even one severe head injury. So preventing head injuries can prevent your risk of dementia. Smoking can also, stop smoking can also prevent your risk of dementia. So exposure to smoking, whether or not you smoke it or you're in an area or someone in your house smokes it, it can lead to increased risk of dementia. So smoking does not only increase the risk of cancer, increase the risk of heart disease, but now increase the risk of dementia. I don't know what good smoking has at this day and age. If you are smoking, try your hardest to try to reduce the amount of smoking you do. I found in the hospital that a lot of people they tend to be able to stop smoking if they do this staggered um, if they're able to just kind of reduce the amount of cigarettes they smoke over a given period of time. I find that that works for them. Some people, they need nicotine treatment, such as like a nicotine patch or nicotine gum. You can always work with your primary care doctor to see what would be best for you. But overall, my plead is to try to stop smoking if you can. Air pollution is another thing that, from a community basis, leaders are looking into. Air pollution has been tied to increased incidences of dementia. So, from a community standpoint, reducing the air pollution within the community is best. And also, obviously, obesity can reducing that can also help with your dementia. So then they go, okay, well, if you're able to reduce, if you're able to have frequent exercise, that is going to help you in just a second. Let me do this real quick. If you're able to maintain frequent exercise, just like we talked about, that will help in let me just make sure. Sorry about that. If we're able to maintain frequent exercises, that's going to help you in reducing your obesity, reducing and also avoiding excess alcohol can also reduce dementia, and also taking care of depression. Studies have shown that uncontrolled depression can lead to dementia as well. Lastly, did you know that hearing impairment, hearing loss can lead to dementia? So they cited that as one of the potential causes or risk factors of dementia, because when people cannot hear, it's almost like they're out of the conversation. And when they're out of the conversation, it leads to isolation, and they're not functioning optimally. They're not able to take part in conversations because they can't hear you. And this experts kind of said it's kind of like if you don't use it, you lose it. So if you are hearing impaired and you can't hear anything, or you're hearing very minimally, you're not able to have that mental stimulation in your brain, and then so that leads to your brain not being stimulated in areas where there's an increased risk of dementia, and those areas start to kind of shrivel up, leading to dementia. So studies have shown that if you actually treat the hearing loss using hearing aids, that actually now reduces the risk of the dementia. So that's something very easy to do. And actually, recently, hearing aids have been actually approved to be bought over the counter. So that should actually increase the availability of hearing aids for everyone. And that's in the United States that approval for hearing aids over the counter happened. Maintain frequent social contact, again, mental stimulation, and then attain high levels of education. Did you know that those who don't have at least an elementary or a child level of education have an increased risk of dementia? That's another thing that they've noticed in studies. So they've noticed that the higher your level of education is, the lower, your risk factor is for dementia. Again, it's that mental stimulation. You're stimulating your mind. So if you're stimulating your mind, then your mind is working and it's not wanting to kind of get lazy and then just stop working, or not stop working, but just work minimally, and then that leads to dementia. So having high levels of education, having high mental stimulation, being frequently with a social community does help. And the second area here says that when you are able to treat your diabetes, high blood pressure, prevent head injuries, stop smoking, uh, make sure that there's minimal air pollution, frequent exercises, treating depression, avoiding alcohol. All that does in the brain is reduce the amount of inflammation that occurs in the brain. So those factors, such as like uncontrolled high blood pressure or smoking, what it does in the brain, if you, for example, are smoking, you're invoking inflammation in your brain. And what happens is your brain starts producing these abnormal proteins. These abnormal proteins start to deposit in the brain, and that leads to damage, which leads to dementia. So that's the scientific angle of why reducing certain things that can cause inflammation in your brain is better for you in the long run when it comes to dementia. And then things like treating hearing impairment, having social communities, having a higher level of education, all that does is just increase and maintain your cognitive reserve. When they talk about cognitive reserve, they're saying it just increases your mental stimulation, more areas of your brain is being lighted up. And so if you are working and actively using your brain will actively continue to work. And that's all that is. So let's go to the next slide. I believe it's our last slide. So like I said, and it's just a repeat of what I said in this previous slide, their recommendations, the experts' recommendations to prevent dementia as best as you can from a community standpoint is to make sure that all children go to school. Simple as that. And then also to have different policies in place where you can help in terms of making sure those with hearing loss are able to get hearing aids. Air pollution is able to be resolved. And also, reducing the amount of exposure of smoking. So that's one of the reasons why, smoking is banned in a lot of places, because it not only affects the smoker, it affects those around them. So for the individual, they talk about, okay, treat your high blood pressure. Make sure your blood pressure is less than, the top number is less than 130. And I remember we did have a live on blood pressure. Using hearing aids for your hearing loss. You want to stay mentally stimulated. Avoid drinking 21 or more units of alcohol per week. Try to reduce the amount of head trauma you have. Stop smoking, regardless of any age. Reduce your obesity and actually increase your exercise activities. And then, that's basically it. So I hope you guys were able to get some information about, dementia and how our lifestyles play into that. The take home message is, even though you may have a family history of dementia, that doesn't mean that you necessarily will get it. If you're able to reduce your risk factors for dementia, as you see some of the risk factors here, that increases your chances of not getting it. All right. Well, thank you guys so much. I hope you guys have a wonderful, wonderful evening. And until next time, see you later.